Adverse drug events are one of the top reasons for readmissions into the hospital.
Patients don't want to go back to the hospital if they don't have to. It's very costly. It's just a huge burden on them and their families, but then also for the healthcare system.
We've been working with HRSA to roll out new teams that have agreed to work on reducing adverse drug events. In the outpatient setting, we were able to reduce our adverse drug events significantly from baseline when we first started this scope of work.
At El Rio, I run the clinical pharmacy program, which manages patients with diabetes, hypertension, cholesterol. Prior to HSAG getting involved with our program, a lot of the information that we knew was happening was really difficult to obtain.
So what we did was we looked at her Medicare population that she's been seeing over the last several years, and we did a study on their readmission rates.
They were a really good resource in looking at our own access database where we were documenting, compiling that information, and then showing in a validated way that we were having a positive impact on the health outcomes of the patient, but then also on the cost. From that, then we're able to adjust our workflow to address and prevent those actual drug events from happening.
We have staff at HSAG that really understand the big picture of the delivery of healthcare, clinical quality measures, healthcare reform. For example, based on our work with El Rio, HSAG developed an adverse drug event database that standardized data collection and reporting and shared it with other QIOs and PSPC teams during a national training and rollout call.
I've seen just a tremendous effort on HSAG part to spread the word about what clinical pharmacy can do, and not just in the health arena, but in the business arena and in payers.
We have in Arizona a very integrated network of stakeholders. HSAG hosted a successful Learning and Action Network meeting in January of 2014, which brought together pharmacists, national leaders in the field, academia, and payers to share clinical pharmacy best practices.
I've just found additional opportunities every time we talk. There's always something that we can collaborate on, and so it's kind of been a win-win relationship for us.